So now we are going to go into the panel discussion. As we have learned over this week, we have further to go to drive survivors and victim-centered approach. Some of this requires us to set aside our individual and organizational mandates and focus more on what we can do together to create the change for the people we serve. This is what our panel is going to consider and reflect on. What can we do better together to create the change, both at policy level, but most importantly at the operational level? We have an excellent panel to guide us through this conversation, from OCHA, UNICEF, Ground Truth Solutions, and independent auditors, the Humanitarian Quality Assurance Initiative. A reminder to all of you, please keep your comments and your questions coming through the chat. As our panelists are coming through. And first, we will hear from Rachel Maha, who spends her time considering this question as the IASC and OCHA's AAP focal point. Rachel, this is a question for you. What needs to happen for a more collective approach to drive the change needed to create more accountability to people affected by crisis? And we would love to hear from you and to hear your perspectives for the initiatives underway at the policy as well as what needs to happen at the country level.
Yeah, thanks so much, Stanley, and also thanks to CHS Alliance for the invitation. It's great to be here. I'm looking forward to the discussion, hearing more about exactly what you've just said, how we might collectively address the question and improve our collective accountability to people in crisis. So I thought I could share some details, rather perhaps than my opinions or perspectives on this, but some details of initiatives that the IASC is undertaking in regards to this. So yeah, I want to be clear that this will be more about what is happening, because I think a lot is already happening, both in countries and operations and at a policy level, thanks to many of you here, and less about my thoughts, but I'm happy to share them during discussion. So I sit in OCHA, as you said, and in the ISC Secretariat as the focal point on AAP. Several years ago, this role didn't really exist, and I acknowledge all the people that have sat on some very precarious chairs in headquarters to maintain a voice in these parts of the humanitarian system. And Meg, it's great to see you there as a predecessor, and I look forward to your perspectives as well. Others have also championed AAP, and the advocacy and action of CHS is very central and loud amongst them, and very important over these recent years. Of course, as I've said, my role is not about my opinions so much on what is needed, but essentially to respond what we already committed to and what we're told on how to respond, how to support countries and operations, and therefore communities, and how to make sure the right tools, resources, connections, collaborations between agencies and networks, such as the CHS Alliance, CDAC, and others, are improved to enable ever better responses to crisis. So to answer the second part of the question, I'll give an overview and talk a little bit about the initiatives currently underway with an interagency focus and efforts that the ISC is taking both at the global and the country level. I think it's worth acknowledging here that we have seen recently an increased momentum and focus on AAP. This has happened at different times in history, but we're seeing it again, particularly over recent months. So just a few things to highlight. So in June, we brought together a cohort of humanitarian coordinators, so field leadership, in a workshop on collective AAP. And they identified the barriers in the system's ability to deliver on system-wide AAP at a country level. They proposed practical steps to make progress based on their own experiences. So we at the ISC are working to respond to their requests for technical support, capacity, as well as good examples of AAP at work. So systemic ways that impediments have been overcome in specific contexts, to include local and national actors in coordination structures, to ensure community participation and feedback is brought into decision-making forums, and to engage in a cooperative partnership with communities where their rights and their views are central to humanitarian action. So it's anticipated that this might be something we pull together for reference for the leadership rather than another guidance note, which, you know, we're hearing very loud feedback on not needing long guidance notes. So part of this is the need to be able to share those examples to overcome confusion that still persists and is a recognized barrier about what exactly AAP means in practice. So following the June workshop, we're focused on delivering and developing workshops on AAP with humanitarian country teams in identified operations. So we hope to engage the field leadership further constructively around developing country-level AAP action plans. And this is a way to field test the AAP framework that's been developed over the past 18 months by the ISC Results Group 2 on accountability and inclusion. And some of you have certainly contributed to the development of this tool. Countries have been proposed because of the championship of the humanitarian coordinators and the request for support on this. So we know that another barrier to AAP has been the need for leadership buy-in. So we're really endeavouring to highlight and enable this. In complement to this, to the AAP framework, is an important tool also developed out of the collaboration within the Results Group 2, and it's called the Results Tracker. It's designed to measure progress on delivering on country level commitments on AAP, and the development of this tool is led and facilitated by the CHS Alliance. So many of you may also be already aware of this tool. It's very much in its prototype stage, and there are plans to pilot the tool, which are currently underway. The results tracker is built around the 9 commitments of the standard and with a number of related indicators. So it's designed to take existing data, to analyze it against those indicators, to come up with a snapshot and analysis on that progress. This can in turn be used to guide planning and implementation, and of course, course correction and monitoring of that. So just 2 more things. I don't know how I'm going with time, but I think it's important just to mention at a policy level, as part of this momentum, a time-bound task force on AAP has been assigned by the ISC to deliver a proposal and recommendations that clearly articulate what needs to be done at the system level. So strengthening the system's collective accountability to respond to affected communities. The group was tasked with blue sky thinking, following Mark Lowcock's proposal in April for an independent commission, and we have carried that discussion forward with this task force in terms of thinking through what kind of system level change might be required, and we anticipate their recommendations in October. And finally, we're working with our colleagues in the SURF and the country-based pooled funds teams to revise funding guidance and processes to further strengthen AAP. So through maximising the flexibility of the pooled funds, and so that they can further advance AAP and promote systemic and innovative approaches to accountability, inclusion, and responsive programming. So I'll leave it there, and I hope and look forward to a rich discussion, and look forward to hearing from the other panelists and the floor in due course. Thanks, Stanley. Back to you.
Thank you, Rachel. And now I would like to hand over to Sansan, who works with UNICEF in Burkina Faso on accountability to affected people. So Sansan, your question would be, you are speaking from us from Burkina Faso, building on what Rachel has reflected on about country level change. Please tell us more about what you see is needed at country level to bring about the change and accountability to people affected by crisis, people in crisis.
Okay, thank you, Stanley. Greeting from Ouagadougou in Burkina Faso. As you say, I'm going to share with you how we translated the IRP into practices in Burkina Faso as a collective responsibilities to create change and with the aims to facilitate the humanitarian preparedness and response. Just a few background of Burkina Faso. I'm going to say that the humanitarian situation began worsening since 2018, following several security threats and security attacks. And this situation has created a large internally displaced population, and estimated at 1.5 million people displaced and over 2 million affected. And this is coupled with the raising of public health emergency as COVID-19 and polio and other outbreaks such as cholera. And this has complicated the response to the humanitarian situation, to the emergencies. And concretely, the response to humanitarian crisis in Burkina Faso started in 2019. And the AAP component was completely overlooked in the initial stage of the response, despite the fact that the view of affected population must inform the preparedness and the humanitarian responses. So this was a very great challenge to mainstream the AAP in the humanitarian response. So I'm going to take you through 5 or 6 points that the country the partners undertook to ensure the full implementation of AAP approach in the humanitarian response. First of all, it was to create, as Rachel had just mentioned, to establish a coordination mechanism. This was very essential to gather all the humanitarian partners. And this coordination mechanism called community engagement and accountability to affected population is coordinated by, is chaired by OCHA with the support of UNICEF and other UN agencies, as well as international and national NGOs. And after the establishment of this working group, it was essential to influence the development of the humanitarian response plan to ensure that the accountability to affected population is well administered and integrated in the humanitarian response. This was a very important issue because, as I just mentioned, there was a lack of involvement, engagement of affected population in the humanitarian response. And what element are essential to influence or to ensure that the accountability to affected population is fully implemented in the humanitarian response. First of all, it was to define the key performance indicators and to track that we can track during the humanitarian response. And this was essential to support the development of the humanitarian response plan because it provided evidences regarding community engagement and accountability to affected population. Second thing that was essential is the generation of evidences. It's a kind of systematic surveys on collective and on community engagement and AAP practices, and also as well as the perception and satisfaction of affected population regarding the humanitarian response. So this was essential to provide such evidences to inform the development of the humanitarian plans, and also to inform the development of humanitarian emergency response project in the field. Another issue that is very important, it was to create a kind of collective movement that aimed to raise community awareness about the humanitarian response. It is to provide to inform communities on the work of humanitarian actors, on what humanitarian actors are doing, what are the rights and the entitlements of affected communities, and what are where services are available. So this was also an important point that was addressed. That is addressed in this in the coordination mechanism. And so far we have also it is important to have the mapping of all the existing feedback mechanism and the feedback and complaint mechanism among all the humanitarian actors to collect, to ensure that there are established mechanisms, there are established communication channels between humanitarian actors and affected communities to provide relevant information to ensure that concern and question from affected communities are collected and properly addressed. And another important issue is the capacity development. Do we have a common comprehension regarding the concept of accountability approach to affected population? This is essential because if humanitarian actors don't have the same common comprehension, and it is difficult, it will be difficult to implement or to ensure the full participation of affected population to the humanitarian response. And an essential key issue that we are addressing here is the financial resources to support activities related AAP activities. And it is clear that most of the time community engagement and the AAP approach is underfunded. We don't have resources to ensure that to ensure the full participation, the full engagement of affected population. So this is a issue that is still on the table and is still on discussion to ensure that the accountability is properly translated into practices. And lastly, an important issue is to ensure, because sometimes we have the coordination mechanism regarding the humanitarian response, and we have also the coordination mechanism regarding the public health emergency response, and how to ensure the linkage between these two coordination mechanisms, the integration of these two coordination mechanisms, to ensure that, for example, the accountability is really mainstreamed in the response to public health emergency response. So this is a crucial issue because sometimes these two components are addressed in a silos approach, and this is not a good perspective. So how we can integrate the coordination mechanism, the RP or coordination mechanism in the humanitarian, in the complex emergency response, as well as in the public health emergency. And we think that it is we think that it is important to have to develop and implement common projects. Sometimes we don't have these approaches regarding the AAP mainstreaming or implementation, and it can be having a.
Thank you, Sansan. I need to move on. You will have an opportunity to expand on this in the panel discussions. Thank you.
Thank you. Thank you.
So now I would like to hand over to Pierre, the director of the Humanitarian Quality Assurance Initiative, an organization that independently audits organizations on how they are meeting their CHS commitments. So And Pierre, HQAI verifies how organizations are meeting the CHS standard, which all, as we all know, are the commitments organizations have made to people affected by crisis. How can we build on this important verification process to drive more change at the country level where it has the most impact on the people's needs? That's your question, Pierre.
Thank you, Stanley. Good morning, everybody, and thank you for the invitation to be in this panel. But first of all, going at the level of the title of this session, if we want to create a collective change in the sector, we need to have rigorous measures to measure the collective performance and to do that with common metrics. Is it at all possible? Yes, it is. And the good news is that there are tools that exist that can be used to do so. The bad news is that these tools are not used or not sufficiently used, which raise questions about the actual political will that we can have behind all these declarations that we are doing. We need to act. So what are the tools? The CHS, you mentioned 9 commitments to affected population. No need to expand on that. The CHS is a measurable standard, and it has a verification scheme that accompany it. Today, about 120 organizations have gone through the verification, half of them through an external audit by HCI. This is indeed giving us a glimpse of the collective performance at the global level. We know, for example, that complaint mechanisms are quite weak in the sector. It's not a surprise for anybody. And that collaborative processes are better. And it's actually where the sector performs best along the 9 commitments of the CHS. Not to say that it is perfect, far from that, but it is where the sector is performing better. At the national level, about 30% of organizations that HCI has audited are national organizations. I don't know the numbers for the CHS Alliance and for independent verification, but I kind of suspect we are in the same range. This said, we are extremely proud at HCI that we have managed this high proportion of national organizations, but this is about 20 organizations scattered around the globe. In other words, our vision of the collective performance at the national level is much more blurred than it is at the global level. Still, these 20 organizations, we were able to audit them because we have 2 mechanisms. One is a mechanism to subsidize the cost of audits, which is very important. It's not enough, but it's very important. The other is probably a more subtle but more important mechanism. It's the group approach. And the group approach is a mechanism by which several independent organizations commit to apply the CHS and jointly commit to be held accountable for this application of the CHS. I don't want to go into the details of the mechanism because it would take us much more than 7 minutes, but we have currently applied this tool within a family of organizations. It's Action 8. It is within the same family, several independent organizations in different places. We are now implementing this approach in collaboration with ICFA with 2 national groups. That is, in 2 countries, Tanzania and Palestine. We are putting in place mechanisms where different NGOs with different governance, they are totally independent one from the others, have decided to jointly go for this process. This is in implementation. And now, this is also going to, once done, once demonstrated, and once applicated, and it's also connected maybe and hopefully with facilitated funding for these national organizations, we can think in the local application at the level of a crisis of these mechanisms. We have not yet measured the collective performance in a crisis, but we do know that we can use the same approaches, the same tools for organizations that would jointly commit to apply the CHS within a crisis. So really the question is now, do we have the political will to do so? Or do we have the courage to do so? I can say in the name of HKI, of course, but I think also in the name of the CHS Alliance, that both organizations would be absolutely thrilled to work together in measuring the collective performance using these tools, adapting these tools. If one of the organization, the coordination structure, the existing coordination structure were asking us to do so. So this is a call joining the spirit of Jan's remarks. This is a call for action. And with this, I'm going to hand over to you, back to you, Stanley. Thank you very much.
Thank you, Pierre. Now I would hand over to Meg, Director of Ground Truth Solutions. Your organization listens to the views of people affected. What are we learning from this, and what will bring about the changes needed to meet their needs? Meg.
Thank you, Stanley. Thanks so much for having me, and I hope you can hear me because my sound was a bit dodgy before, but we'll see how we go. It's a great question, and I think Jan actually put it quite well in his keynote, where he said, quite simply, we need to listen to people. But more than that, we need to not just be able, but willing to act on what they say. And I think that's what I want to focus on today. And for those who are unfamiliar with Ground Truth Solutions, we basically collect the perceptions of people affected by crisis to hear how they are experiencing a response and what they think about it, to hopefully affect some change based on their feedback. I was happy today when we weren't allowed to use PowerPoints, because I didn't really want to do the usual ground truth thing of showing our data, which tends to paint quite a grim view of things, and then share recommendations. Because I think I get a bit uneasy increasingly when people are sort of impressed by that and feel like it's accountability, and that's an initiative and it's good, and that the accountability stops there. Because the truth is that the real work starts after that process. And for us, generating action based on feedback data is so difficult and often feels really like pushing a rock up a hill, and it's tiring and it's a huge political challenge. So I definitely would echo the things that Pierre was saying on that front. We have a lot of evidence that people do not view their experiences of humanitarian aid very favourably. We have tons of evidence like that. And we're not talking about general dissatisfaction because people are in difficult situations. We get feedback on things that could be fixed if only the will to fix them was there. If you consider our work in Nigeria recently that showed that people don't feel empowered there to even express a choice about what aid modality they'd prefer, let alone to have that preference met. Or our work in Chad, which has shown this persistent gap between how humanitarians think accountability is going and how affected people think it's going. And that despite the long-term nature of that crisis and constant rhetoric about resilience and the nexus, barely anyone there feels that humanitarian services are really helping them to get on their feet. We also see that in country after country, place after place, year after year, People are selling the items that are distributed to them in order to buy the things that they really need. You know, can these problems be addressed? I hope so. I think they can. But let's not think they can be addressed by more accountability initiatives, of which there are many. Let's rather think about this feedback and see if that helps us think through what changes are actually needed more systemically. So in that front, I would sort of echo a lot of the sentiments of the speakers before me. I don't know if we need more frameworks. I don't think we need more commitments. As Rachel said, we certainly don't need more guidance notes. I'm not sure if we need many more accountability initiatives or people sort of lending technical skills, because we've realised now that systemic problems really need systemic solutions. Activities on accountability are not ends in themselves. You know, us doing a survey and listening to people is not accountability if no one acts on it. A surge staff going in and coordinating a response is not accountability. These initiatives help, but what is done or not done as a result of these things is down to these daily decisions that are being made by leaders at all levels of the humanitarian system. And I think real accountability becomes about a response being managed in such a way that it demonstrates more broadly that the whole point of that response is to support crisis-affected people to deal with and recover from situations in a way that's relevant and timely and respectful. Accountability is really a management issue, and it was nice to hear Rachel sort of flag it as such through some of her remarks. I think if we return to some of the examples provided before from our work, they point to these political failings that, you know, so-called AAP experts like us, we can't possibly fix them. So, you know, why do people constantly get aid that they don't need and sell it? A feedback loop or an accountability advisor can sort of help to address that problem, but we need to think about the environment with which that problem sits. You know, this is a supply-driven sector in which need is often determined by this laundry list of sector-based questions that are asked once a year. That's a barrier. And so the answer to this, you know, would include a shake-up of the needs analysis process. What would happen, for example, if a needs assessment simply asked people, what support do you need that can't be covered by cash? Or where are your own efforts to respond succeeding and where do they need a boost? And I think a visionary leader rolling out a reimagined and more kind of common sense humanitarian program cycle in line with community priorities would be a step towards systemic accountability. But, you know, these sort of AAP activities around the edges are not. Our work in the Central African Republic shows us that people are not being consulted at a very basic level, and that many humanitarian actors cite a lack of funding to set up a feedback mechanism as the main reason behind that. I think that's another systemic failing. You know, if people are still viewing accountability as mechanisms to be piled on top of already long to-do lists and not simply a fundamental way of working, of a way of ensuring that we're providing relevant aid to people by listening to them, that's a problem that I think only brave leadership at this point can fix. So if we take leadership as kind of the lever here, accepting that political effort is needed to fix the system rather than throwing more mechanisms at it, then this question of incentives again comes to the fore. You know, what are the carrots? What are the sticks when it comes to adaptive management? And sometimes what are the cop-outs? You know, terms like flexible funding, incentives, unfortunately, these become weasel words as well because they're repeated so much and they're sort of posed as concrete solutions. But practically, what do they mean? You know, where's the performance management of humanitarian leadership teams based on their responsiveness? Or where's the strong proposal for an adaptive program to a donor instead of excuses about why donors don't allow flexible programs? So I guess I just want to conclude, you know, by urging us all to think now what is needed to take all of this AAP effort to the next level. We're in a good position because we have reams of guidance about how to support leaders, but there's not much talk about how they're being held to account when responses don't listen to people or encouraged to demonstrate where people's views are actually having an impact. I think the work of the last 2 decades has put this sector in an amazing place to be able to use the tools that we have. We have the CHS, we have the work of the grant bargain, we have data services like ours, we have this endless guidance that you can download from ReliefWeb, we have HCI, CDAC, you know, decades and decades of community engagement expertise gleaned from local agencies. And so I think now it's kind of time to shift the political focus to adaptive management and accountability. You know, we have Jan Egeland on the call today being held up as this inspiring exemption when he says as a leader that we need to start by listening to people. But that needs to become boring. You know, that needs to become the norm for every leader. And then I think we'll start to see the process of listening to people really start to mean something. So I'll stop there because I think I've gone over time, but thanks so much for having me.
Thank you, Meg. I would like to ask you a question for all of you and to reflect on. And the question for me is, how do you balance the fact that you have your accountability is actually finally provide relief or support for the local communities so that they can recover from crisis, or at least be in a better place after a crisis? At the same time, is you have another need, which is that the people who are providing the funding, who are providing the resources, they want to know that there is accountability along the chain for the resources that are being provided. How do you balance that? And also, how do we then work with that at a systems level to make sure that we have collective action? Who wants to go first? Just jump in if you are ready, please. Yeah, Jan? Sorry, Pierre. Yeah.
Unmuting myself. This is a tricky question, but at the same time, it is one. Again, we have the tools to resolve that. We have a CHS. The CHS identifies what has to be brought to people. It focuses on people. What we have been able to do at HCAI is to bridge the CHS or the CHS audit with due diligence requirements of donors, and in particular with the ECHO. So by undertaking an audit based on the CHS slightly extended, we have been able to cover at the same time the elements that make that an organization delivers and will continue to deliver good aid on the ground and assist the people. Again, I insist on the fact the CHS is about the people. So all what we are talking about is within it at the core of the CHS. But at the same time, reassuring ECHO that the organization in question can respond to their more pragmatic financial mechanisms, the needs for this organization to have financial mechanisms. This has been done with ECHO. This is being done with other donors. And we do have, for example, a very interesting project with FCDO and Danida, where they want to test the extent to which direct funding to NGOs can be brought based on a CHS, again, slightly extended audit. So there are moves in this direction. There are very concrete proposals that are made, but we also have to realize that it is the very beginning of the understanding of these mechanisms within the sector, and progress is, for somebody like me, is desperately slow, but there is progress, and in this perspective, it's quite positive.
Thank you.
Over to you.
Someone else wants to reflect on what Pierre just said? Go for it, Rasha.
Thanks, Stanley. I was thinking to reflect actually on something else that Jan had said, which, you know, I think we listen a lot. As Meg said, there's a lot of laundry list of surveys that we do. I do think actually we're data rich in ways that we didn't, you know, that we created this richness of data, but the question is what action is taken as a result of that, and whether that is even analyzed, understood, and delivered into the spaces where it needs to be heard, and that action is taken as a result of that. So, I mean, and, you know, I think everyone's, you know, discussed the gaps. I think we do need to acknowledge that we have come a long way, but I think that, you know, we really sort of create these sort of things that we need So we need to understand community. We need to have this data. We need to have this evidence. But the question is, of course, then what? And so, you know, the action that results from that is really where, you know, while that's a choice and while it's an option to take action or not, I think, you know, we're still stuck. As for the you know, the systemic solutions that Meg was talking about in terms of responding to systemic problems, you know, I think that's why we need to sit here and really identify them, and then ensure that those that do have the power to do something about that are hearing that, are enabled and expected to do something about that. And I just to wrap that point, I mean, I'm sure I haven't really answered the question, but I think we talk a lot about lessons learned, and I often feel like that we have lessons, but unless there's action, we really haven't learned them. So the learning is, you know, is really evidenced by the change that we see. And, you know, unfortunately, I think we're having conversations that, you know, we've had for years around this. And of course, that's notwithstanding the improvements we have been able to make. So those are my thoughts, Stanley.
Thank you, Rachel. Sansan, you wanted to say something?
Yes, thank you, Stanley. Just on a more operational perspective, here in Burkina Faso, we are discussing on this issue in the coordination mechanism because since 2 years, it's difficult for humanitarian actors to reach some affected community due to security constraint or other constraint. So we were obliged, or we are obliged, to rely on community actors to make sure that humanitarian assistance reach the affected community. So this is essential to, as Pierre just mentioned, it's essential to bridge the CHS with the donor requirements. And we are discussing with technical and financial partners here to help integrate or mainstream the accountability in the financial process or in the financial requirements. So to ensure that this is there is a common language, or there is a common comprehension between the humanitarian actors and the donors. And this is a relevant issue because most of the time, before humanitarian actors came, after that humanitarian actor has gone, we only have the possibility to work with the community. So this is also to see how we can improve our language, the advocacy that we do on the accountability of affected population. Thank you.
Thank you, Sansan. Meg, do you have anything to add to this conversation?
Not too much. I want to very strongly echo what Rachel said. I think just about there's no just incentives, but there's just sort of not a lot of people putting pressure on leaders to sort of demonstrate that this stuff's happening. I mean, just one thing to add would be a concrete suggestion about how we monitor humanitarian responses as well, because I think at that sort of collective systemic level, another thing that Jan mentioned was the amount of money that gets wasted on reporting. And a lot of the reporting is based on these evaluations that are done, again, in this really supply-driven way. Kind of perpetuates. And I think if even a minimal amount of that resource was diverted to actually trying to, try to make sure we are listening to people more regularly and more systemically, I think that could also help to some extent to bring the gaps more into the fore and for more people to sort of use that information to hold these leaders to account. So yeah, just a small thing that I might add there.
Thank you, Meg. So now we take questions from the audience. And there's one question which is directed specifically to Pierre, and it comes from Esther Dross. as we talk a lot about localization and national resources, is there any plan to move HKAI verification and certification to national, regional levels so that small CSOs and local NGOs can access certification?
It's pronounced HKAI, and we have a video on that with where we filmed many people trying to pronounce our acronym in different ways, but that's not the question. The short answer is yes. A little bit more complete would be, I mentioned earlier the group at the national level, and this is clearly one mechanism, because these different NGOs that group together within the nation to undergo these processes actually need to put in place a, let's say, for lack of other term, an auditing mechanism, an assessment mechanisms within their group at the national level. So there is there the capacity to, there's a development of a capacity to measure. Also, we are, I slow down here because I could easily go into so many details that everybody would be lost, including the time we have. But we are working in having more auditors in more places, although we already have auditors in the 18 countries, which is not too bad for the time being, but even more diverse, and also creating a system where there is a network of local experts that can input into the auditing processes so that there is less need to bring auditors from all over the place. Localization of auditing services is actually our main project.
You got muted.
No.
Okay, now I can hear you.
Okay, so I was finishing by saying that actually the localization of the auditing services through different mechanisms, and this is a very specific definition of localization within HKAI ambit, is our main project for that, and also that we have just agreed to expand the scope of our subsidy fund, until now subsidy fund, to also bring capacity at local level to undergo audits. If you're interested, please go to our website, contact us. There's so much to be said about that. And as I have the floor, just to say, when Meg was speaking of amazement that accountability is still outside of the normal way of proceeding and needs an add-on, I had this image of a car that we build, but where the brakes are an option. You know? It's simply incredible, but I stop here.
Thank you, Pierre. We have one more question coming up. Sarah Machmochi. Question to Meg: how do you think AAP is being adapted within a humanitarian development peace nexus?
It's a great question. I mean, the easy answer to it is, I would say, very badly. It's been something that we've been trying to look at recently, particularly in contexts where there's protracted crises and a huge amount of development work, and the feedback that we get from affected people cannot necessarily easily be acted upon by a traditional humanitarian program, because often people in those situations, you know, what they really prioritize or need or want are longer term impacts or sort of longer term goals. We've had situations in certain countries where we take this feedback about, you know, we have this consistently negative metric on people's ability to recover from a crisis, which is where this peace and development nexus would fit quite nicely. But when we sort of take that to response leadership and say, we don't want to stop asking people these questions just because the humanitarian sector isn't really equipped to act on it. So what's the coordination like, at the leadership level, again, to bring these different people together so that when we're gathering feedback, there's more of a holistic range of long-term actors who can act on it. And we get sort of dismissed when we ask that question, because I think a lot of people see that still as being too hard. So despite the fact that there's all this rhetoric about this, I think the system in the way that it's currently structured and the architecture that exists in these humanitarian responses doesn't necessarily allow for it. But that said, I think that's where a lot of the potential is. And we at Ground Truth are really trying to now shift some of our work to look at this nexus idea and think through who could our other interlocutors be, so that when we are this intermediary for feedback, that we're actually more able to provide it to people who are more willing or able to act on it in a way that humanitarians aren't. So we're looking at, participation in peace processes, we're thinking through this development nexus, durable solutions, and just sort of trying to find a whole host of other interlocutors who could work with us to hopefully make sure that as we keep asking people these questions, that process becomes more meaningful, because hopefully some of these metrics will improve. But we're certainly still thinking through that a lot internally. And I mean, Sarah, it would be great to talk to you about it as well at some point. But yeah, that's just my sort of current thinking on it.
Yeah, thank you. And what you are talking about, I think, is back to the question we are asking here today, is the question about how can we collaborate at a systemic level to ensure that we deliver on our mandate to the people that we serve. And my question to Rachel is the programs that you are running on leadership addressing this issue, or can they address this issue?
No, it's a good question, and I did want to follow up about the leadership, because I think it's about all the pieces coming together. The leaders, the humanitarian leadership has a very onerous task, especially when the way the system is structured is responsibility falls almost solely upon a humanitarian coordinator, one person in that role, and then there's structures around that person for decision-making processes to take place. I think, and that humanitarian coordinator has many areas of responsibility and mandated accountability for those areas of responsibility. It's completely impossible, really, for one person to be able to ensure all of those things. So this is where it comes back to the collective accountability. Of course, I suppose just to acknowledge that we're trying to ensure that leaders are enabled to do this, and that HCT's humanitarian country teams are expected to also support the humanitarian coordinators in that. This is very, talking about this sort of ISC structures and architecture. But I do think that, we all have a piece to play in that. And I think that our role is to really demonstrate what we expect, to enable them to put it into action, and to find those ones who really can and do and will. And I think I can certainly vouch for many of them that's the case. But they're in, as again, back to what Meg said, it's a systemic problem. And I think then we have to really engage the donors on the same sort of level of responsibility for expecting them to enable this shift and enable action as a result of what we hear from communities, and program adaptation. So there's not a silver bullet, and I don't think that there's a solution that if only the leadership would do this, then we're there. I think it's all of us, really having collective expectations about what we want to see happen, understanding that it's a systemic problem, working at all those levels to try and enable and create a system that allows for adaptation based on communities' needs. And I'm not talking about solutions. I just want to acknowledge as well that leadership is just one part of the issue, I think. Actually, Stanley, you're muted, I think. Sorry to jump in.
Thank you. So Pierre, the mic is yours, and can you also look at what would inspire leaders to change as we are talking about change in leadership or transformation in leadership?
What I wanted to say is we should also be aware when we speak of collective accountability that it does not become an excuse for not being individually at the level of organization, individually accountable as well. So as not to fall in the situation of the tragedy of the common for the environment. So yes, for collective accountability, it's very important, but the individual responsibility is also absolutely key. And we need to keep that in mind and not shift the burden to some kind of collective entity that is not identified. That is the point I wanted to make. What was your question, Stanley? Can you repeat, please?
What will inspire leaders to change, or how can we inspire leaders to change?
Many things, but at the end of the day, money. And if organizations and the leaders of the organization can have facilitated access to funding, if they can be it can be demonstrated credibly that they do implement accountability, this is going to change. If this is not happening, accountability will remain an add-on, an option that many people, many organizations, and as a collective, we will not buy because it's too expensive. So it's at the end of the day, all these mechanisms are based on a lot of goodwill. We all want to make the best thing of it, but money, managing an organization is the driving force, I think. And the responsibility of donors in this perspective, and when I speak of donors, it's not only governmental donors, it's also the UN system, of course, but NGOs, INGOs working with other NGOs and with partners. The responsibility of donors in this perspective is huge.
Thank you. Sansan, any comments on what would inspire leaders to change?
No, yet. Thank you.
Great, thank you. Meg, would you like to say anything about what would inspire leaders to change?
Yeah, sorry, I'm having a few connectivity issues. I think, I mean, I agree with Rachel that I think they need support to sort of know where exactly they need to change. I feel like, you know, to some extent, as the AAP community, we've not always been the best at that, because I think we've sort of come together and put together in the past like a lot of very probably low-level recommendations that for people who are so busy, they ended up seeing that as another, you know, to go back to Pierre's car metaphor, I think, you know, that has been a bit of a failing, where we give them these laundry lists of things to do and they say, that's too hard because I've got another list for PSEA and I have another list for gender and I have another list of things that I'm supposed to be sort of piling on. But I think it's also just this something to do with performance management, and I'm not sure how exactly we can address it. I take Rachel's point about, you know, obviously an HC has so much on their shoulders, but they are ultimately accountable for that response. And if you look at the way, you know, the private sector works, someone in that leadership role is ultimately accountable for facilitating a team of people who achieve a certain thing. And if they don't, you know, there are repercussions. So I think at all levels of that leadership sphere, from how they sort of manage downwards and how people around them are, you know, fulfilling their own leadership roles, whether they're heads of agencies or part of the HCT or a donor who sits on HCT or, you know, whatever it is. There just needs to be some sort of, you know, stick there, I would say, that we start implementing now, that we have all these different guidance notes and things like that in place.
Thank you. Thank you, Meg. And thank you, everyone, for your passionate contributions and also very, very thought-provoking reflections on the situation, on how we can collectively work together to make the system work for the people that we serve. So I would like to thank you once again for joining us today, and please stay for the next sessions. Right. So please join the speed networking. I really enjoy it myself. And you go to the reception, and from there you can get back to the speed networking, and followed by the expo booths to chat with members of CHS Alliance team on different subjects. You can also find more information at the reception. After the break, we will go back to workshops, and also you can access those at the stage tab. And the workshops are actually on Zoom, so you will find the links at the stage tab. And we will see you back here at 2 p.m. Central European time, and looking forward to see you. Hopefully I meet some of you at the networking. See you in the afternoon.